Hello and welcome to Eat Right New Hampshire. I'm Christine Lauer, a registered and licensed dietitian and a member of the New Hampshire Dietetic Association, as well as a member of the National Association, the Academy of Nutrition and Dietetics. And today on Eat Right New Hampshire, we are going to be talking about a subject that really affects every family, some member of the family, or sometimes most members of the family. We are going to be talking about functional GI disorders. To say that clearly, it's issues with our bowels, particularly irritable bowel syndrome. And one of the things that's interesting about this is these types of problems have been around for quite a long time. And now we have the science today, so we'll be talking about how you can manage it, the steps, the symptoms, with my guest, who I'll mention in a minute. But I wanted to point out, to let everybody know and remind people, these are books from the 1920s and before. Intestinal management, auto-intoxication, intestinal toxemia. This is a book by J.H. Kellogg, and we all know Kellogg. He developed his brother developed a cereal, and this doctor developed the Battle Creek Sanitarium, which we all know. Other issues, here's another doctor, constipation, intestinal ills. So my theory is that around 1850 to 1890s, white sugar, white flour became available to the average citizen, and by the turn of the century, all the doctors were focused on the bowel. But that hasn't really gone away, which is really interesting. So we have maybe more bowel issues today, maybe not, but it certainly is quite prevalent. So my guest today is an expert in this area. She is a registered dietitian. Her name is Kristen Flagg. She works out of Parkland Medical Center. And basically, she studied and helps people in her daily practice that have irritable bowel syndrome. So welcome.
Thank you very much for having me.
It's a pleasure. Why don't we just start out? IBS, irritable bowel syndrome. What is that?
So irritable bowel syndrome is basically a functional disorder, and it has to do with how the muscles and nerves work in our body, as opposed to, say, Crohn's disease or ulcerative colitis, which is something that would cause permanent damage. IBS does not, but it is very uncomfortable for a lot of people. And
so you're saying it doesn't cause permanent damage,
no permanent
but it causes day-to-day upsets,
upsets in your life. You know, if you need to run to the bathroom, always know where the bathroom, is going to be located. It can disrupt your work schedule, maybe not, showing up on time because you're having, stomach issues. And those issues may be cramping, abdominal pain, bloating, gas, diarrhea, constipation. Sometimes for some people it can be a combination of diarrhea and constipation, so it's a mix between the two.
So do people get attacks? Is that something, would you describe it?
Yeah, it can come on very suddenly, so that's
okay. So
why
it sometimes it's a surprise.
Sometimes a surprise. So people living with IBS, there's different degrees of it and everybody handles it differently in their body, but oftentimes I know people who've experienced, they always want to know where the bathroom is, they always need to know.
Right, so if they're going out or going to a party, or they have to go to work and they have a long drive.
Exactly.
So those are issues that can occur.
Things that can happen in
you said the stomach feels upset, bloating, sometimes painful. Can it be the opposite, or constipation?
Yep, like I said, it can be diarrhea, and then it can be diarrhea for a couple days and then turn into constipation. It can be a mix. So you never have one or the other.
So you never have regularity.
Exactly.
All right, so that's a problem.
That is.
So that's what you mean by functional. So as in Crohn's disease, it destroys your gut. Mm-hmm. This could destroy your life or your social life, but not necessarily
and the other
your gut.
Crohn's and colitis are treated more medically.
Right, so as opposed to that, where the villi in your intestines are being destroyed and things of that nature. This doesn't really destroy the bowel.
Nope.
It just doesn't, the function just isn't controllable.
Function. Right.
Okay, but I know today we're going to talk about how you can actually help people manage this a little bit better.
Exactly.
So for IBS, you said earlier before we started this, there are some certain risk factors that you look for?
Yep, oftentimes it affects females more than males, and in the general population, probably 1 in 10 people experience IBS at some point. So that's quite a few of us.
Can it be stress-induced too?
It can be stress,
okay.
Yep. It usually is diagnosed before somebody's in their early 30s, mid 30s. Like I said, female, before age 35. And sometimes people have a family history, maybe a first degree relative who have similar symptoms, but maybe it was never really
But there is
diagnosed.
no genetic inheritance of it, is there?
No.
Or you
I'm
don't
not
know?
sure how that works.
Okay.
Yeah,
Or maybe
but
it's a stressful, sometimes families have, is it nurture or
right. I
or
mean,
nature.
so stress can play a factor in that.
and a weakest system?
Also, their lifestyle, hormones. That's probably why it may affect females more than males.
Is this relatively new, or do you think it's been around since the turn
I
of
think
the
it's been
century and
around
before?
a long time, and I think people just find a way to cope with it. But now we have better tools, and there's been a lot of new research. And the latest research is actually coming out of Australia, where a group of scientists have been studying this, and they've pinned it down to a group of carbohydrates, certain carbohydrates, which we'll get into.
Certain carbohydrates. All right, so
So-
there comes that carbohydrates appears a lot nowadays, but we're going to clarify.
Yeah, but some other things in the diet in general, the way people tend to deal with this in the beginning, sometimes they may notice high-fat diets having a impact on their IBS. So they may start by eliminating, high-fat, fatty, fried foods,
So
things
it's really,
like that.
it really is individual, though.
Individual, yep.
So we'll talk about that. Complications of IBS? Any particular ones that you have that you?
Again, there's no real serious issues associated with IBS, but it can, again, disrupt your quality of life, depending how bad it affects
And
you.
that's a problem, because socially we'd like to be able to do, be free to go and do what we want,
what we
take
want
trips and
and
all of that. So that can
not have
be
to worry
a little
about it.
life curtailing. So you put your life on hold until maybe it gets better. But unless you actually see a doctor and a dietitian, and I'm going to say probably by the end of the program today, that specializes in this,
Correct.
it's going to be very difficult to get a handle on it. It's just going to keep repeating itself and repeating itself, because you don't really know why.
Right.
And
Yeah.
and technically, medication, I would imagine, is a big part of how they treat it today, but that
Sometimes
doesn't,
with medication,
that doesn't help
and
it,
sometimes
doesn't
with
disappear,
higher
though.
fiber, a higher fiber diet. But even some of those types of diets or fibers that they're adding into the diet may not be.
So that's
friendly
a,
for
okay.
us,
So
which
here's
we'll
the point
talk
that
about.
everybody really wants to know now at this point. So how does one manage IBS?
How do we manage it? So we're going to be talking about what we call a FODMAP diet.
FODMAP.
FODMAP.
All right.
And what that stands for, it's kind of a mouthful, but they're different types of carbohydrates, and they're fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So that's the whole
Okay.
encompassing
Well, here's the problem
types
with
of
that.
carbohydrates for
Most
FODMAPs.
people, most people don't think in terms of their foods in those terms.
Correct.
So,
So what these are is these FODMAPs describe a group of poorly digested carbohydrates. And for a variety of reasons, they trigger those symptoms that we talked about, the abdominal pain, the bloating, the diarrhea. And when these carbohydrates go undigested in our small intestine, they continue down into our colon. When they hit the colon, that's where the bacteria feast on these carbohydrates and causes this fermentation process.
okay.
So if you think about maybe adding sugar to some strawberries, you get a lot of fluid coming out.
Right.
That's what happens in your colon. It's producing this gas, this
Is that,
fluid,
that's not the
and
same
that's what
as
sort
putting
of-
culture in yogurt?
so that's
No?
what comes
That's
about
different.
with the diarrhea. It's that fluid.
Okay. So, but that's
So it's
not,
that
is
fermentable.
that fermentation or is that another
It's
thing?
fermentation.
Because what happens with, so it's not the same as yogurt if you put a culture in yogurt and it creates, or sauerkraut that creates fermentation. Is that a different
it's
thing?
probably similar.
It's probably similar. So sometimes it could be good, sometimes it could be bad.
So with these types of carbohydrates, right, we'll talk about the different types of carbohydrates in foods, and within each of these groups, it's sort of a progression of high to low of how much they have of these carbohydrates, and again, how they affect your body and how they can have a cumulative effect.
You gave me a list, and thank you for that, because the FODMAP, what it stands for, I don't really think in terms of myself, even as a dietitian, but I know what you mean. So you said here, you gave it as lactose. So
Yep.
there's one, fructose, fructans, polyols, and galactans. So again, that still doesn't help us anymore, but
So
people
let's-
recognize lactose and fructose. So
Right.
let's start
we'll
with
start with the
lactose.
easy one, lactose. A lot of people know that they may have been diagnosed actually with a lactose intolerance. So lactose is the primary sugar found in our milk and dairy products. And sometimes as people get older, they experience more, gas and bloating from milk products. So we want to think of this FODMAP as these types of carbohydrates. So again, think of these carbohydrates going into a bucket. So the first one is our dairy products. So we're going to put the milk into the bucket. The next one we'll talk about the fructose. And fructose is a sugar. It can come naturally from honey,
Oops,
but
there
it
goes the bread.
also can come from our high fructose corn syrup. So people with IBS, drinking soda may not be a great idea for them.
But it can also be fruit.
But it
Correct?
can also be fruit. Yep. So it's found in natural sugars such as honey. It can be in our fruit juices and concentrates. It's in some of our yogurts and sports drinks. And
See,
again,
I don't think that's a good
big,
idea for anyone with IBS or not, but that's just,
Yeah, and-
sodas and things like
Yeah,
that.
and in
but
general, that might be something that your doctor says to eliminate in the beginning, get rid of the carbonation, which
especially if you
can
have
help.
IBS. so,
Right,
okay.
exactly. The next group,
The
we'll
fructans?
talk about the fructans, and this is an interesting one. It does include, big culprits are onions and garlic.
Onions and garlic.
Onions
and
and
those
garlic.
are the sulfur, I believe.
And then wheat comes into that.
Vegetables.
So that's where your wheat may come in. So a lot of times people sometimes think, oh, I'll start by eliminating the gluten. And that might be a good place to start. But you may have one of these other groups going on as well. So again, it's that cumulative effect.
So I think that's why seeing a dietitian that's experienced in this is smart, because people eat all these things cumulatively over the course of a day. You might not get the effects. You might
Till
have a
later
can
on.
of soda for breakfast, heaven forbid, but I mean, let's say you do. No problem, right?
Right.
But by after lunchtime, when you put the bread in there and then the milk with that, and if that's a problem, now by 3 o'clock your stomach is bloated and
Exactly,
you
all
have
that
gas
fermentation
and you
is
don't feel good,
taking
and
place.
you're thinking, well, geez, it can't be. What is it? I didn't eat anything. I just had a glass of milk.
Yep. Another one of our groups, some people know or may experience problems with sugar alcohols like sorbitol. So
Okay.
that's a big one.
Maltitol, xylitol, sorbitol, common
appears in
in
your sugar-free
diet
and
products and gum, and
diet-free
things.
groups. Yep.
Yeah.
So that's a big FODMAP. That's the sugar alcohols.
Now that's natural as well, so it's not just
it can
added.
be, and naturally, it's usually in our stone fruits and pears. So peaches are a culprit, and pears in that
So some
group.
people cannot digest them.
Cannot digest them. Correct.
Okay.
And then the last group, and apples are a big culprit. And then the last group, which a lot of us have problems with, is our dried beans and legumes. It's a fancy term. That's the oligosaccharides that I was talking about.
So those are the
And
galactans.
those are the fancy term for the beans and legumes. And a lot of people have problems tolerating those. We might feel a little
Many people
gassy,
get gas
especially
from it,
if you're not used to eating them on a regular basis.
but if you have IBS, that can be more
That
than
can-
gas. It can be very painful.
Exactly. And again,
And-
it could be because of that cumulative effect of something you've had earlier.
So the cumulative effect, I want you to go back over that a little bit, just so that people understand really
Sure.
what that is. Because a lot of times people come in, and I'm a dietitian, but I'm not specializing in this, but often I hear, well, there was no problem. There's no problem until like 4 o'clock. So it wasn't that. It wasn't, my breakfast is not a problem.
Right.
But it actually starts way back
Probably
then.
starts way back then, yep. So let's say we had a piece of toast for breakfast and we felt fine, went on with our day. Maybe we get to lunch and have the soda. And then maybe a little bit after, you are having problems because it's that cumulative effect, or else adding that
And
on
then you
to
have
dinner.
that for supper.
That's going to be a real big problem.
So if you
Or
have
could be.
IBS, that's a bad combination.
It's not a good combination.
So basically, it's how much stuff goes into the bucket and starting to look at it differently. So that's what you do as a dietitian who's trained in this. You teach people to look at
They're different
what
types of
the
foods.
different types of foods they're putting in the basket all day.
Right.
And then you would help them by how?
Right. Well, again, the symptoms vary, and the thing to know is that one approach does not fit all.
Okay.
The treatment, some other things to think about would be your meal size, how much you're eating at a time, or perhaps even if you're skipping meals. So your meal size. Alcohol can have an effect.
If you're having a glass of wine
Fat
or a
can
mixed
have an
drink.
effect. And then fiber. And fiber is something that, again, somebody who's specialized in this would know that some of the doctors are putting you on these fiber supplements. But
Yes,
one of them,
to keep you regular. And
the big one is inulin, which is found in some of our granola bars and
it's put in
fiber
yogurt.
balls.
It is inulin in
And
yogurt.
that's
It's added in a
it
lot of
is.
today's, I guess I call them designer foods.
Yep, yep.
And you
so
mean
yogurts
that's
are there.
a lot of people with IBS don't tolerate that.
So that's where you need
Do
to
they
run
really
into
know that?
someone who knows that. Yes.
Right. So they wouldn't even pinpoint that that was the problem.
Exactly.
Probably.
Yep. Yeah. So they could be adding to the problem
Right.
depending on the type of fiber that they are being, given. And then, looking at your lifestyle, stress, I feel, definitely has an impact
Stress
on
is an
this.
issue.
Some people go fine, and then a stressor comes up in their life, and it kind of exacerbates the problems. And then looking at different, like I said, medications and supplements. So it's more than just the diet.
So this is an interesting aspect, and I don't know if you're ready to talk about this or that you haven't, or there's something else you wanted to say there. But let's say I have IBS now. What am I going to do? Do I see my PCP? Do I look for a GI specialist? How do I find you or a dietitian like you in
Yeah.
this area?
I think the first step would be to make an appointment with your primary care physician, and they may refer you to a specialist, and that would be a gastroenterologist. And perhaps they'll do some more testing to find out that maybe, they want to rule out something like Crohn's or ulcerative
Right, and make sure you
colitis.
don't have
Make sure you
blockages
don't
or
have
other things
permanent
like that,
damage
so.
and things actually going on. So some more extensive testing. And then during that time, it would be good for a person to maybe keep track, get a notebook, record your symptoms, record maybe stressors going on in your life, and if there's a correlation there. Bring your list of medications so people can see what medications and supplements you're on.
Are there any medications that can precipitate
So,
issues with the bowel that you know
Not
of?
that I know of offhand, but
okay,
again,
so
the supplements
wouldn't be-
that would be more,
Okay.
the dietitian's role with the supplements. List of questions, and then maybe starting to keep a food diary to see, maybe you notice, oh, I eat an apple and I really have stomach problems after I eat apples.
30 minutes later or 2
yeah,
hours
yeah.
later. So it's more data collection so that you can actually
So-
piece it together. And I know, because
Right.
a lot of people grumble, oh, I have to keep a food diary. I don't want to do that. I don't have time to write all that
But
stuff
what
down.
the dietitian can do for you is we have lists that we can provide you with of foods high in FODMAPs, low in FODMAPs.
So you make it easy.
Make it easy, a grocery shopping list. And what we would do first if you came to see a dietitian who is specialized in this would be to go on an elimination diet.
And
And
therein
that's
is the
usually-
that's difficult.
But it's not long. And most people who have been experiencing these symptoms have been experiencing for years, and they have had no luck, and they're more than willing to do this for 2 weeks.
So so for 2 weeks.
2 weeks, you get rid of all these carbohydrates.
All right. So what are you eating in those 2 weeks?
A lot of protein. Again, we would give you the list of, FODMAP friendly. So we could do some lactose-free products. We could do some different cheeses. Those
So you
are
could
fine.
actually
different fruits,
You
different
could eat
vegetables.
a meal. You could have certain
yeah.
foods. So
Yeah.
it's not.
It would
it's
probably-
not like you're just eating white rice or something for the.
It
for
would be
2 weeks.
gluten-free. so
Gluten-free as well.
Rice would be
Okay.
fine. Yeah.
But you give people an idea of how to put that together.
And again, it's not a long period of time. 2
Now,
weeks.
should they experience some relief from symptoms
right away?
in that 2 weeks?
Probably within 3 or 4 days.
Okay.
And that's what keeps people motivated because they're feeling well pretty quickly.
And the point of the elimination diet is after the 2 weeks, what
You come
happens?
back to the dietitian, and then we again go through sort of a diet history, see which foods we can start adding in, and it's a very systematic approach in where we add back these carbohydrates, but one group at a time.
So based on what you've seen so far, their food diary and what they've said to you,
Yep.
you pick which one comes back first.
Yeah, so we might think, okay, we know they don't have a lactose, they've never had problems with lactose, so we might just add this one back first for a few days and just to be safe, know that everything's fine, and then we know
So at
we're
least
safe with the lactose.
3 days, 3 to 4 days
Yep, and
before
it's
you
a
add
very
something else.
systematic approach in which we add the different groups back, and then after we've sort of find out what the trigger is, then we want to find out a tolerance. It's not that we want to eliminate these foods for life, and I think that's our dietitian
Okay.
role, is to give a person as much variety as possible within their diet, lifelong. We don't want to be,
So somehow,
knocking foods out and totally never going
if they
back to them.
can add them back, you'll find a way for that to be done. If it's something
In
that they
certain
cannot
amounts.
tolerate, then sometimes
Yeah.
you just may not be able
You may
to
not
have
be able
the
to have
soda
them, but
again,
certain
or-
things, like I said, maybe you can tolerate 1 piece of toast versus 2 pieces. Different things like that. So trying to find that tolerance and that nice balance
Now,
is
a
the
lot of times,
long-term goal.
When I've dealt with people in the past, when people come with gut issues or bowel issues or GI issues, I find that what they've done is they've morphed their life into just eating processed white flour, fiberless foods because
Right.
those are the safe
They
foods.
think the fibers,
But
bothering them.
unfortunately, that provides no nutrition and could have led to part of the problem in the first place.
correct.
So is that something that you obviously
Mm-hmm. Yeah,
discussed
yeah,
that and counsel
yeah.
them? Because they were afraid to eat anything
They're
but that
afraid,
because
yeah.
that's
It's
the
been a
only thing
long
that worked.
time, and yeah, they feel comfortable with certain foods, so it's trying to get their diet more balanced and branch out into foods that maybe they haven't tried in a long time.
Are there any
and-
types of vegetables, for instance, that would be good for them in that 2-week elimination diet that might not cause major problems?
Oh, there's a whole list of, yeah, definitely. There's a lot of them that don't cause problems.
And is there a technique as far as, how nowadays we say, make a salad with 20 different types of vegetables in it?
Certain ones, they do recommend a certain amount, whether you're going to stick to a quarter to a half cup, or maybe just a half cup at that particular sitting, but doesn't mean you can't have
What
it
about
more than once
variety,
a
though?
day.
Less variety at one meal, right? You can have different foods, but wouldn't it be
It
best
could
to
be.
say maybe one
Especially in the
vegetable,
beginning,
one
especially in the
vegetable
beginning.
versus 6 in a stir fry might be able to
be,
be better tolerated
Yep.
as you're adding that back, you think? I
Yep,
don't know.
again, it's a very systematic approach, and you learn
depends
your
on the person
tolerance,
sitting in
and
front of you.
everybody's going to be individual. So that's why, again, you really need someone who knows the diet. And you could probably go out and do the elimination diet by yourself, but that's not the end point. The end point
That's
is
the
to
beginning.
get the variety back into your diet and make it
That's
balanced.
where you've achieved some safety. You know that there's a problem with
Right.
the FODMAPs, or the carbohydrates. So you want a low FODMAP diet, perhaps.
Correct.
And even if you add some foods back in, you'd probably be low FODMAP for the rest of your life.
And like I said, gluten is a big one that people eliminate to begin with, but then they find out, well, they're feeling better, but not completely. So there
How do
might
you
be
work
something
with
else.
the GI
working
doctors?
with
Because
that.
sometimes the PCPs are there, but they're not experts in diet for issues like this, and FODMAPs are becoming known now. I have a book here that I brought that actually is written by a GI
Yeah,
specialist.
a
to
lot
help
of the
his
GI
patients.
doctors are familiar with this at this point.
At this
It's
point, they are.
very, it's coming
Do they have
to
somebody
be.
in their office navigate, or do they refer to you?
Ideally, they should be referring to a dietitian.
Because
That
it's
would
time
be-
consuming to do this and
Yeah,
to
they
work
don't
with
have
people.
time. And again, we're the experts. They know about it, but they may get as far as putting someone on the elimination diet, but not going
And
the
then
next
sending
step.
them home.
Not this next
and
step of
then-
adding the foods back in to see their tolerance.
And then what happens?
Right.
I know you have a reference guide that you're working with.
Yeah,
And I
I-
wanted to show that. And I don't know if the public, if that's available like in Barnes & Noble,
think
or is
so,
that
yeah.
for someone that
Nope, you
is
can order it on
specializing in
Amazon, I
treatment?
believe, and it's by Patsy Katsos, Catsos, and she's a registered dietitian out of Portland, Maine, and I went
She's
to one
local.
of her workshops.
She's one of the leading experts in the country,
So
too.
this is her second edition, Changing Your Carbs, Changing Your Life, free at last.
Because it's hard to tell when people are looking which
What
book is
books?
the
There's
right
so
one.
many out there.
So she's one of the leading
Yeah.
experts. She's
And then
studying in Australia
The other one
as
I
well.
would recommend is anything by Kate Scarlatta. She's a registered dietitian out of the Boston area. She does a lot with GI nutrition. She's been to Australia.
Okay.
And worked with
Australia
these.
seems to be the point
This
where
is
they
where
started
this all
doing
started.
this. That's interesting. And this is interesting because you probably don't know this gentleman, but he's a GI doctor, I believe, in Michigan. And he put together a low FODMAP diet because he was struggling to find something for his
Exactly.
patients. So I think that basically what's happening is obviously the FODMAP, and this is what FODMAP, because we spelled it, but there it is, low FODMAP,
Yep,
right?
FODMAP. There's been articles. I mean, there was one published in U.S. News and World Report. Not sure. This was within the last year, so you'll probably come across this now that you know the word FODMAP. You may see it, maybe in different articles or in the
So now you'll know what it
newspaper,
means.
so now you'll
But if you're
kind of know,
struggling
but-
with any GI issues at all, this is something that
And
I
if you-
think is good news, and you should know this.
Yeah,
And
and it's on the internet. You'll see it.
I make it
once
sound
you
more difficult than it
investigate.
is, but I think that when you feel such relief from doing
Exactly.
this, that
That's
it
the big thing.
motivates you and it becomes easier. Especially if you have children that you may not be aware of that have some issues with FODMAPs, this is perfect because now you can use these shopping lists that you have there and go grocery shopping with it and sort of change that. I had heard that sometimes the soluble fibers are more easily digestible for people that struggle with IBS than the insoluble. And we've been told from the days of Kellogg's, they went with the insoluble. They said, load them up, it had the cereals and the bran cereals and all of that.
Yeah.
But that wouldn't work
Not
for people
exactly.
with IBS. So more things like peeled, yams, sweet potatoes, some of the winter squashes, peel the summer squashes.
Yeah.
So there are techniques that you can use to heal the gut, so to speak, or to let the gut rest.
Function better, yeah.
Function
yeah,
better.
Yeah.
All right, so that's good. We have about 2 minutes left today. So is there anything that you want to recap? Maybe recap what goes in the basket
Again,
and the
that
types
there's
of
different
FODMAPs?
types of the FODMAPs, and it's the lactose, and then we have the beans, onions, and garlic. I don't have here, but those can be a huge culprit. Apples are big. Things with wheat, so your wheat breads and pasta, and then watching things with honey and high fructose corn syrup.
I'm going to make you do that one more time, but this time I'm going to say, okay, which one out of the
Okay.
FODMAPs? Lactose.
Lactose, again,
know that one.
milk and dairy
Okay.
products.
Fructose.
Fructose is going to be more your sugary drinks with corn syrup especially.
Fructans.
Fructans are going to be more your wheat and pastas.
Polyols.
And polyols are going to be some of your sugar alcohols, and then the last one.
Is that the
No.
sugar alcohols? How about the fruit? How
Yeah,
about,
the
is
fruit
that a
comes into
polyol
one of
perhaps?
those. Yep,
Okay.
and then the
And the last one is galactans.
galactans, the dried
Galactans.
beans and lentils.
Okay, so if you're having an issue with the GI tract, first thing, start keeping a record, keep a food diary, put the symptoms on there and the
Right.
times when symptoms appear,
Yeah.
and call your PCP, or if you're going to a GI specialist, call them and ask to be referred to a registered dietitian. Oftentimes the insurance picks
Yeah.
it up because it's well worth it to help you.
But again, make
on
sure
a-
the dietitian has training in this, because not all of them
Right,
do.
not every dietitian specializes in it, and it does take a little bit of knowledge and some skill to work with people on an elimination diet,
Correct.
particularly in this case.
Right.
So, Kristen, I want to thank you very, very much for being on Eat Right New Hampshire today.
Thank you.
And until next time, eat well, and health begins with your very next bite. So thank you for being with us today. Can't wait till next time. Take care.